Hi, and happy OCD Awareness Week. My name is Sam Edwards, and I am a therapist here at CFCE. This week, we are shining a light on obsessive-compulsive disorder, which can be extremely difficult to live with, and it's often misunderstood or misrepresented in our world today. I am here with today's topic to share some good news with you, and that is that OCD is extremely treatable. I really love engaging in OCD treatment with children, teens, and adults. And as you may have learned already this week, OCD as a brain disorder can cause a person to get trapped in a cycle of performing compulsions in order to bring temporary relief to obsessive thoughts and fears. So you could think of it like this, okay? You're on a road trip and OCD is constantly trying to be a backseat driver or call out demanding turn-by-turn directions without you feeling like you have a choice to even drive the car yourself. So how do you break free of this cycle? Well, one of the best and most effective treatments that we have is called exposure and response prevention, ERP. And it's the gold standard in this field for fighting back OCD symptoms. So you might be thinking, oh no, Sam, not another therapy acronym. Yes, there can be a lot of acronyms in therapy. So let me just sum it up for you a little more clearly, okay? ERP treatment helps you break free of the OCD cycle by intentionally doing the opposite of what OCD demands that you do. So a therapist like myself is going to help you to delay or change or straight up do the opposite of what OCD is telling you to do. So let's use our road trip analogy again. It's like intentionally making a left when OCD tells you to make a hard right. I know it sounds kind of backwards, and I get that that's a weird thing. This approach is likely to cause some distress, at least in the beginning, and that's actually how we know that it's working. This treatment works so effectively because it teaches you that over time, you can build up a tolerance and a resilience to distressing thoughts and feelings and sensations in your body that OCD obsessions can cause you. Essentially, you are going to learn how to take back power from the OCD so that you can drive your own car again. What I love most about treating OCD is that it is never boring. It is very active. We might do things outside of the office, out in the real world, and you get to be involved in helping to design creative exposures that are tailored specifically to address your personal obsessions and compulsions. Ultimately, OCD treatment is about helping you to believe that you are so much more than your OCD. You deserve to reclaim your life. You deserve to drive your own car. It's not going to be an easy process, okay? And OCD symptoms are not going to disappear overnight. But I want to deliver a personal message of hope that if you or a loved one is struggling with this disorder, there is a way out. So let's get driving.